a total of 58,460 confirmed cases have been recorded as of today, 29th day of September 2020, with 49,895 cases treated and discharged. This result is from a total of 509,555 persons tested for COVID-19. Sadly, the number of deaths arising from the disease now stands at 1,111 from the 36 states and the Federal Capital Territory. We currently have 7,454 active cases which are being managed at home or in treatment centers, with about half of them in Lagos State alone. The number of active cases has continued to drop, consistent with the general trend in Africa. We will continue to revise our discharge criteria in line with new knowledge of the disease, even as we continue to strengthen our case management pillar to provide effective and efficient quality care to all those who test positive, whether they're in our facilities or in home care. As business and schools begin to open and as travels begin to pick up, we fear that we may have a surge in the number of cases unless we scale up surveillance and review our response plan to integrate new ways to deal with the disease. In line with this, the Nigeria Institute of Medical Research has developed a molecular test for COVID-19 that can give results in less than 40 minutes. It is the SARS-CoV-2 isothermal molecular assay, SIMA, which can be performed by low-skilled personnel with minimum training. The rollout will be very soon, as announced by the chairman of the PTF. This test, which is 10 times cheaper than the PCR, can be deployed for point-of-care detection and surveillance. The technique, which was developed by Dr. Chika Nwama, will be deployed for use as soon as it is validated by the relevant agencies of the ministry for specificity and sensitivity. I commend the management of Nigeria Institute of Medical Research, led by Professor Salako, and particularly Dr. Nwama, for this laudable breakthrough. I also extend the appreciation of the federal government to the Faith Philanthropy Coalition for COVID-19 Support Fund for funding the project. And particularly, I thank the chairman of that coalition in the person of Fola Adiola. Government will continue to support every genuine initiative that contributes to our response plan. On Friday, 25th September 2020, we had the privilege of performing the commissioning and handing over of the Infectious Disease Center at the University of Abuja Teaching Hospital, which is purpose-built infectious disease treatment center as part of the commitment of the federal government to providing the necessary infrastructure and resources for infectious disease management. It will go a long way towards improving our capacity to respond to all infectious diseases. It is a fallback facility which we do not have to put to use if we observe all necessary preventive measures, such as wearing face masks, observing respiratory hygiene, and physical distancing. In addition, we also need to ensure that we test and isolate all those with symptoms that suggest COVID-19. This morning, the top management committee of the Federal Ministry of Health played host to the Victims Support Fund, who are the ministry to officially present some IT equipment to the Federal Ministry of Health to boost technical capacity of personnel to support our response to the pandemic. The Victim Support Fund has been supporting the Ministerial Expert Advisory Committee on COVID-19. We wish to use this opportunity to thank General T.Y. Danjuma and the management of the Victim Support Fund for the initiative. We recall that the fund has also supported the NCDC as well. We shall again renew our appeal to the state governments to continue to ensure that we step up case findings, sample collection and testing. It is only by testing that we can identify those with infection for isolation and treatment. This is the only way we can truly halt the spread of the disease and confirm that we have actually contained the pandemic. Our goal is to have at least one standard infectious disease center in every state. We shall therefore work with the states to establish purpose-built treatment centers that will ensure we are better prepared for infectious disease outbreaks in the country. I thank you for your kind attention.